The journey into adulthood is a difficult and often a confusing one for young people as they go through a lot of changes. Physically, emotionally, this is an important time for one's physical and emotional development, and it can be more difficult to make good judgments about one's sexual health and risk-taking. The Zambia Demographic Health conducted in 2018 revealed that 17% of women had sexual intercourse by the time they were aged 15. About 29% of Zambia's adolescent girls and young women are already pregnant or mothers. All these statistics have faces of young people, and the consequences are lifelong. SAfAIDS, through the generous funding by Sweden, has been implementing the Social Accountability Monitoring for SRHR model in Chilenje and Tendere in Lusaka. The model seeks to strengthen capacity of young people and youth networks for improved demand of SRH services by young people and the corresponding youth-friendly services provision. This is being aided by the MobiSAfAIDS application, a real-time app used to identify and rank service delivery challenges being encountered by young people when accessing SRHR services.
I joined the Transforming Lives project that inculcated the MobiSAfAIDS app in 2019. And the people involved were SAfAIDS and Africa Directions that brought a bunch of affable peers and trained them on the MobiSAfAIDS. I'm one of the trained people.
So this intervention, among the activities that they were doing, was to provide a platform of a MobiSAfAIDS application, which gave the young people ability to be able to share their challenges that they encounter at the health services.
When the SAfAIDS came in, we were already providing SRH, but when they came in, they really wanted to know if at all there were challenges in the young people accessing the services. So they would raise issues in all the entry points, and you assign them accordingly to healthcare providers who provide the service there and then.
I think one of the key successes with it is the starting point with the fact that this is a model that was implemented by young people themselves. If you critically look at the approach itself and the model, it's a kind of model that has the capacity to outright link, those seeking services, those that are providing services, and those that are providing oversight right in the same platform. And we've been able to see quick responses in terms of addressing some of the challenges that are being encountered by adolescents and young people in accessing their services.
Many of the times when young people go to the health facility, they could find that the services such as condoms, HIV counseling and testing services were not available, or rather they were told that they were only being given to mothers or pregnant women.
Adolescents used to shun away from accessing services at the facility because they would say the nurses themselves that would provide services to the adolescents had a very bad negative vibe towards the young people, saying if I go and access, probably I want to get a condom, this person will say, you're very young for you to start accessing such services. What is it that you're doing in the community? This is wrong. When someone accesses something and then they give them a bad attitude, they tell a mate, meaning the same news will go in the community and becomes a hazard to our community.
What has led to the improvements in them, the numbers coming for services, we can attribute this to the relationship, the good relationship that has been created between the young people and the service providers.
We're able to relate to the health facility and talk to them about different kind of issues that we may undergo. And the project has really come in handy to say, if those people are talking to us, we can really say, it's okay, this is for the young people and it's really going to work for them. So it has brought in that great relationship between us, the focal points, people at the health facility, and bringing in the youth-friendly corner at the health facility for us to easily access the kind of services that we want there.
During the COVID-19 pandemic, we really had a situation where adolescents weren't moving, we couldn't mobilize. We really loved to create accounts using community mobilization and engagement. But during that time, it was very hard. But now, because of the MobiSAfAIDS app, we also utilize social media. And during those platforms like WhatsApp, Facebook, Twitter, and Instagram, we actually managed to still engage youths to actually consider taking the app. We explained a lot about the app, and it was very beneficial during that time.
Chilenge was one of the COVID centers. It was closed just to provide the COVID services. So for these young people, we knew that despite having the COVID pandemic, they would come for the service. So we had created a tent outside the facility where they could access the service. And also using the application itself, even when they've not entered the facility because there were some restrictions, it will just come to me as an administrator. There's this young person who would want to access this service. It didn't affect us much.
One of the good programs has been comprehensive sexuality education, through which information which is age appropriate, delivered by trained teachers. So in order for us to defend this, it was necessary that we turn to civil society, such as SAfAIDS. They were able to give us a lot of information in terms of the numbers of those who are dropping out, the numbers of the rate of pregnancies in our country, including best practices from other countries. And as I speak today, we continue to teach comprehensive sexuality education, and rightly so, in our education institutions. So I think that the interactions have been useful, the programs have been useful, and we only thank SAfAIDS for this, the fact that we've not been left out.
We are very confident that we are going to continue seeing fruits that as a result of this particular approach, even beyond its lifespan. So we are really hoping that all these different stakeholders will be able then to pick it up and will be able to continue providing support and hopefully to see that this approach actually gets sustained.
For Zambia's experience, the SAM4SRHR has improved service provision for adolescents and young people in Tendere and Chilenge, as well as given a voice for adolescent young people evidence-based advocacy.